Good evening, everyone. Thanks so much for joining us for Facebook Live. Tonight's topic is general surgery. And we have two wonderful general surgeons who are here to join us tonight, Dr. Mark Johnson and Dr. Byron Dotson. Thank you for joining us.
Appreciate the opportunity.
Yeah, we're so excited to have you guys. You know, you have a wonderful patient population. Hopefully some patients can join in tonight, ask you guys some questions. So get your questions ready to go because we have two of the finest here to answer them. All right, let's get started. So the first question, which is one of the best questions, who are you, what's your specialty, and what really brought you to Mon Health? Dr. Johnson.
So my name is Mark Johnson. I'm a general surgeon. I have been here at Mon Health for 22 years now. I went into general surgery because my dad was a general surgeon and I wanted to follow in his footsteps. And the best thing that happened to me in my professional career was the opportunity to work with him for the first 18 years of my practice here in Morgantown. So I've enjoyed being here ever since then.
Now, were you born and raised in Morgantown?
Yeah, I'm a native. I'm native of Morgantown, but I went away and did all my schooling away from home. My joke was that after I got done with my education and training, that my mom reeled in the umbilical cord and brought me home to work with my dad. So yeah.
I'm sure she loved that.
Yep.
Awesome.
Yep.
Dr. Dotson.
My name is Byron Dotson. I'm also a general surgeon here at Mon Health. I'm originally from Ripley, West Virginia, a little further south in the state than this. Did my training in Pennsylvania and then ultimately came back. I was a medical student here and loved the hospital, loved the family feel, and ultimately wanted to come back to it.
That's great. Why general surgery? I mean, obviously, Dr. Johnson, your father. Why you, Dr. Dotson?
For me, I just love the breadth of what general surgery is. Surgeries became very subspecialized over the last few decades, and I really appreciate that in my day as a general surgeon, I can do thyroid surgery, and I can do colon surgery, and I can do hernia surgery, as opposed to being kind of boxed into one specific operation or a handful of operations that you do all day.
And I don't think really a lot of patients know how many surgeries general surgeons do. You know, they think you only do a few here and there, but you really do a whole gamut of things. So we'll discuss that. I'm sure that's a question that will come in. Next thing we want to discuss, you're both robotic surgeons. So what are some of the minimally invasive procedures that you're doing here at Mon Health? What are some examples?
This week we've done colon resection. We've done a couple of different hernia repairs, different kinds of hernia repairs. Most general surgery procedures can potentially be done minimally invasive. So that's a lot of bowel work, gallbladder surgery, hernia surgery, things like that.
Okay. Alrighty. Next question: how quickly can I return to everyday life after having a robotic procedure?
So return to function after robotics is very similar to laparoscopy, which is the standard ports with a camera method that has been around for a while. The difference in robotics and laparoscopy is you can do far more advanced things robotically than you can laparoscopically. As far as return to work, it varies. If you have a hernia repair and you do a desk job. Some people have their hernia fixed on a Friday and they're very motivated and they go back on Monday. I tell most people they should plan for at least a week off, but you have varying motivations of people who just can't stand to, be laid up for that long.
Sure.
The key difference, I think, is when you talk about minimally versus an open or a standard approach to surgery, that's really where the difference comes into play. And for example, a standard hernia repair, we would oftentimes advise 4 to 6 weeks of recovery time, meaning no strenuous activities, no exercise. If you do anything more than desk job, maybe out of work for at least 2 to 3 to 4 weeks. The advantage of a minimally invasive approach, specifically robotics, is that you cut those times in a half or a third, and so most people are back on their feet within a few days, and they're back to doing normal activities and even exercising within a couple of weeks. The difference is that because the incisions are so much smaller, the discomfort related to the incision, the healing related to the incision, and the potential wound complications that could happen are minimized, and that's why people not only feel better quicker, but get back to normal activities a lot sooner.
This must be so cool to discuss with your father, robotic surgery and how things have evolved. What's that like?
Well, it's great. I mean, when he started training, there was no minimally invasive surgery, and he was sort of on the leading edge of learning to do laparoscopic surgery. He and some of the other surgeons in this hospital went off and did a training course that learned how to use a laparoscopic instrument. And so to see it evolve from that level of sort of figuring it out as they went to the point now where we really, we're several generations advanced in terms of instrumentation. But because of that, the ability to do much more complicated procedures, and that's what's great about the robot, is the precision that the robot gives us so that we can do things much more technically accurate and precise than we could ever do laparoscopically, with other advantages. The camera allows for magnification so you can see better. The robot gives us three-dimensional vision so we can actually see as if we're doing the procedure inside the body. It's really impressive technology, and most importantly, it really helps us to do a better job taking care of people.
Sure, absolutely. All right, perfect. Next question. Surgeries that patients may think they don't really know that you do, maybe like thyroid surgery, things like that. What are some examples? That's a good question.
As I kind of touched on with general surgery, I love that, we do such a broad amount of things. We have days where often Dr. Johnson and I will be doing cases together and assisting one another, where we'll have a thyroid cancer surgery, we'll have a colon cancer surgery, we'll fix a complex abdominal wall hernia, we'll do robotics, we'll both go our separate ways and do endoscopy. And being able to do all those things here and provide that for this patient population, I think is huge.
Not to mention having such a great relationship. A patient should feel so comfortable being in the OR with the two of you. You have a great dynamic. You really do. As you laugh. Yeah. I can see it, and I would feel very comfortable in the OR with the both of you. Actually, this comes up as the next question. What is the team approach at Mon Health? How do you work with other physicians within the system? How does that work?
Well, I think there's a couple different things to say. So, as I mentioned, my goal in my life was to come back to Morgantown so that I could work with my father, and that started a process of working together. We would schedule big cases. Tuesday was always the day that we did big cases together, and then Wednesday I would do things and he would do other things, and but we were always around and available to help each other. And so even after he retired and Dr. Statler came and Dr. Donson came, I've carried that tradition going forward. So we schedule bigger cases to do together. I think it helps us as surgeons to know that, particularly in a case where there's some technically challenging details, to know that you've got somebody across the table that's very capable of helping you. I think it's much better for the patient, because I think you get two thinking people in the room at the same time, working together, working through a process, and whether it's a complicated problem or an unexpected finding, I think the fact that we can sort of bounce ideas off each other makes for a much better experience for everybody.
That's fantastic. That's wonderful. All right. Next question. We have a question, another one. Did you play video games as a kid? That's a great question. Talk about robotic surgeons. I'm sure, Dr. Dawson, you want to take that?
So I did play quite a bit of video games as a child. It was funny, I was having a conversation with one of the nurse anesthetists the other day about how he's kind of struggling with letting his child play video games. Mm-hmm. And in my experience, I lived in rural West Virginia. My access to the internet was AOL dial-up. I'm sure everyone remembers that lovely noise. So there was no online gaming for me. I could just play games on the console. I truly do believe that increases manual dexterity. And I wasn't only a gamer. I played tons of sports. I played outside all the time. I had a very country upbringing. But I do think there are some advantages to that and kind of the adaptation to the new robotic technology now.
Yeah.
When I was a kid, there was Pong by Atari. That was it. So I really didn't have an opportunity to play video games as a child. So
you just developed the skill as you went.
I did.
That's what matters.
I did. Well, it is. I mean, there is an element, particularly. You don't just show up on your first day of surgery residency and do a robotic case. You learn from the anatomy. You understand the interplay of tissues, and you work your way to the point where you can, in your mind, know what's going on. And then it's not really foreign to do that through instrumentation, whether it's a pair of scissors, or whether it's through a laparoscopic scissors, or whether it's through a robotic scissors. It really is sort of the same concept. It's just like anything else. Learning the instrumentation, learning how to use the console is it's a small part of the whole process.
Do you have a lot of patients who are hesitant about robotic procedures, or are they inviting of them? What do you see?
The one question, so most people are very receptive. They like the idea of minimally invasive surgery. They know what that means. They understand that they're going to get better quicker, that they're going to have less pain after surgery. I mean, and I always say minimally invasive surgery is less painful, not painless. Everybody should go to the operating room knowing that when they wake up, they should have some discomfort. That's normal and not troubling. It's not a problem if they wake up with some pain. Of course, we'll manage it, but that's not scary to have a little bit of discomfort. I think most people are receptive to the idea. The hesitancy that I hear the most is, well, what's your role if the robot's going to be doing my operation? And that's a great opportunity to explain that, I think the robot is just simply a tool. It's no different than a pair of scissors that I would use to cut a suture. I have total control over the robot. I have total control over what it's doing. I'm doing the work, but I'm simply using the precision and the techniques of the robot to accomplish what I want to do. So when I share that reality with most people, then they don't tend to be they're relieved, and it doesn't seem to bother them as much.
Good. That's good to hear. Okay, next question. We knew COVID would probably come up. Am I safe in the hospital for my surgery despite COVID?
So I would say absolutely. The hospital is a highly vaccinated place. People in the hospital are taking all the precautions. The sanitation policies put into place when this all began last year are excellent. I mean, I bump into one of my favorite maintenance workers on the elevator numerous times a day because she's wiping down the buttons because it's a high-touch area. Yeah. So it's certainly safe to come in. Precautions are being taken. Masks are mandated within the walls of this hospital. And I think overall it's a fairly safe experience.
And the reality is, I mean, there are things that we do that you can modulate. You can electively choose when you want to get a colonoscopy or a mammogram or something like that. But a lot of the things that we do because it's essential that they be done. And then it's just a matter of, well, do you wait until your condition worsens? What's worse? Avoiding coming to the hospital, which I mean, I know Kroger's hates it when I say this, but it's a lot safer here than it is in Kroger's, right? Because we pay attention and we wash our hands and we wear masks. And so I think it's a lot safer here. And therefore, I think I don't have a problem encouraging my patients to have the right things done. I don't have a problem supporting them when they need to have procedures or get testings done. I think it's perfectly safe.
Because I'm sure in the heart of COVID last year, you probably saw a lot of patients who put things off who shouldn't have. So you're probably really encouraging people to...
No question.
Right.
I've taken care of several patients who regretted not being a bit more aggressive about their health care.
Right. Okay. Next question. In general, what can I do to reduce my risk of complications for a surgery? Is there something that patients can do?
So for surgery in general, the key things that increase your complications for most surgery are smoking, obesity, uncontrolled blood pressure, diabetes. And those things can all be modulated, but within a way that's reasonable. Obviously, somebody that needs something done urgently, you can't tell them they need to go home and lose 40 pounds, quit smoking, and get their sugars under control immediately, because the reality is nobody can do that. But I know I have patients that I follow for hernia that have small hernias, not terribly symptomatic, that I'm working with them. I refer them to nutritionists. I refer them to primary care providers to kind of help them make improvements so they can come in and have surgery that's going to be more durable and safe.
Okay. All right. Next question. What is the recovery process like for gallbladder surgery?
Most of the time we do gallbladder surgery minimally invasively, either laparoscopically or robotically, depending on the surgeon and the options available. 90% of the time that's outpatient surgery, so you would come to the hospital, have your procedure, and go home the same day. Certainly if you have health conditions, or maybe you're a little older, or if you have a really, really sick gallbladder, you might need to stay in the hospital for a day or so. Within a few days, most people are up and moving and around. Typically, I tell most of my patients, if you can walk up and down a flight of steps without taking pain medication, then you can get behind the wheel and start driving again. So usually within a few days to a week, people are driving. In terms of heavy exertion and exercise, maybe a week or two of recovery before you would do something like that, just to protect yourself and prevent a hernia or some other wound complication from being too aggressive.
Okay, thank you. Next question. What is the difference between robotic surgery and laparoscopic surgery?
So one of the things things I love to stress to patients when I talk about this is robotic surgery is purely a tool of laparoscopy. Laparoscopic surgery just indicates that we're making smaller incisions, we're using a camera, we're using longer instruments instead of making hand-sized incisions. The huge advantage of the robotic tool is the precision, less trauma to tissues. When you think of a standard laparoscopic instrument, you can think of your Craftsman's tool set. It's a straight angulation. It can move up, down, left, right, and it may open or close, and that's it. When you look at the robotic surgical instruments, they have wrists just like my hands, so it's almost as if I have tiny hands inside the patient, able to suture in ways that you could never suture through a straight line.
Wow, perfect. All right, thank you so much. Next question. How do I know if I need thyroid surgery? What would I experience to know that I need it?
To be honest with you, most people that have a thyroid problem, they don't know that they do. Generally speaking, thyroid nodules, lumps in the neck, that may be something that you would notice by looking in the mirror. Maybe something that your physician would notice when they do their examination. I've had patients that have had screening ultrasound exams and have identified thyroid disease and have come to me. There are certainly thyroid conditions, but to be honest with you, most thyroid functional problems are managed medically. We tend to do surgery mostly for thyroid nodules or concerns that maybe it's a thyroid cancer. So usually it's a lump of some sort.
Okay. When patients come to you, do they come directly to you for a consult, or are they being referred to from primary care, or how does that work?
I would say it largely varies. I've certainly had patients show up in my office who have identified an issue and came in and said, please help me with this. The bulk of referrals that come in through our office come through a primary care provider because they're kind of the gatekeepers. Sure. When people have a problem, they tend to go to their primary care provider if they don't have an established surgeon, and they do the basic workup. They may order that thyroid ultrasound or do that exam that identifies a problem and then refer them to the specialist that can help them.
Okay.
Yeah, we don't. You don't have to have a referral to get into our office. And we take a lot of word of mouth. Whether it's I take care of a patient and their wife says, "Hey, can I come talk with you about this problem?" Or the neighbor down the street does the same thing, and so we're receptive to that if we can help. Obviously, there are certain things that we do and some things that we don't. So we'd want to make sure that we can provide you help if you need it, but just like Dr. Dodson said, most of the time the patients have come through somebody else, a healthcare provider, their primary care provider, and then they'll come to us for once they've identified the nature of the problem, and so that we can help them.
Okay, that's a good question because we do hear that a lot. Next question: do you listen to music during surgery? That's a good question.
Yes, I can answer that for both of us.
Yes.
What kind?
I vary a ton. I had this, odd high school phase where I liked Nirvana and I liked a little bit of emo music, which does get played from time to time, and the OR hates it. Country is my go-to though.
Yeah, that's awesome.
Yeah, I think it's it kind of helps. It's soothing a little bit. Sure. So I don't like heavy metal in my OR. It just gives me a headache, and but certainly I'm a product of the 70s and the 80s, so you'll oftentimes hear classic rock in my OR. I like country too, so there's a lot of country music in my OR.
Rolling Stone kind of guy?
There you go.
All right, perfect. Next question. Oh, okay. What does the process look right now for surgery when it comes to COVID? Are your patients having to be tested? Are they allowed? How does that work?
That's truly been an evolving process throughout this. Initially, everyone got tested a few days before surgery, and Melissa in our office, who honestly keeps the place running, coordinates this. She coordinates your test, she coordinates the date of your surgery. You leave our office with all these dates and information and her phone number, and everyone calls her back. And she does such a good job with this. With vaccination becoming more prevalent, that has been acceptable instead of having a COVID test. But we don't know how that's changing as everything's evolving right now.
Yeah, and still we deal with urgent and emergency problems, sometimes COVID related, but sometimes not. And so There are some times that a patient will show up in the emergency room, for example, with an urgent surgical problem that we don't really know what their COVID status is.
Right.
Obviously, for the again, if you're being thoughtful and careful about COVID, knowing that you don't have an active COVID infection is an important thing to do before you would undergo an elective procedure. So we certainly encourage testing when it's appropriate, encourage vaccinations when, as a general rule, but particularly for surgery too. But it's just, unfortunately, healthcare is still there with or without a COVID problem.
Right, absolutely. Next question, how long will it take me to recover from an appenectomy?
Recovery from an appendectomy is very similar to what Dr. Johnson described for recovery from a cholecystectomy. The caveat I would give to that is sometimes people wait just a little bit too long to come in and their appendix is ruptured. In that case, sometimes it's treated with just antibiotics, and that can really kind of prolong your recovery, over the course of weeks, as opposed to having a surgery, having it removed and recovering in the fashion we kind of discussed.
Okay.
But it's a very variable course.
Okay, gotcha.
Another good example, by the way, I'm sorry to interrupt you, but another good example. So again, when I started my career here, when I finished my training, laparoscopic appendectomies were sort of novel and new, and we were doing them, but not frequently. The standard approach was an incision appendectomy, and those patients were in the hospital an extra 2 or 3 days, and they were out of commission, not working, not going to school for a couple of weeks. And now, with the advantage of a minimally invasive approach, mostly laparoscopic, most people are in and out of the hospital within 24 hours and within a few days to a week, unless they've got a really, really sick appendix. They're back to normal and functioning in school and work and so forth.
You hear about that a lot, though, right? People wait until the last minute and their appendix ruptures. It's almost like a common thing. You see that a lot?
Part of it is the variable presentation. Not everybody has the classical, go look it up on Google description of appendicitis, and so that's kind of a challenge. But yes, so certainly. I think there is an advantage to acting quickly and promptly to unexplained, in this situation, abdominal pain. If it persists for more than a few hours or certainly more than 24 hours, it really does deserve evaluation, and there's a value to acting more aggressively.
Oh, sure. All right. Next question. What's your favorite surgery?
That's really hard to say, given that I love the breadth of what I do. But, I would say one of the things that I'm most passionate about is probably advanced hernia repair.
Why is that?
I love the anatomy behind it all. Whenever you have to go back into a recurrent hernia, oftentimes the six-pack muscles have been separated so far that there's no human way you could ever just pull them back together and suture them back, or it would fall apart. So you truly have to know the anatomy of your abdominal wall, the different muscles, the different layers, and there's certain muscles that if you cut, you can restore normal anatomy. And I just love the beauty of that, because anatomy is kind of the basis of surgery.
Oh yeah, absolutely. Dr. Johnson.
I think my favorite operation is a hiatal hernia repair. We do that for patients who have bad reflux disease, gastroesophageal reflux, heartburn, indigestion. I like it for a couple of different reasons. One, there's some great medications out there now, so most people that have that condition don't need to come see a surgeon. But by the time that they do, they're pretty miserable. Those medications maybe used to work and now they don't. So they're really struggling and suffering. From a technical standpoint, I think it's a challenging operation, but with a lot of that gives me a lot of satisfaction. It's a very precise in how it's done, the steps in doing it. And I think that when you're done, you can look at it and say, yeah, that looks much better now. I'm very pleased with the appearance. So it's satisfying to me. And, again, patients walk away from that experience overwhelmingly so grateful and happy and off their medications and so forth that it's a generally very satisfying experience.
That's great. All right. Next question. Most advanced medical tech you've seen or used? Most medical advanced technology? Good question.
I would say one of the biggest advances in technology in recent times is probably the robotic platform in general surgery.
I just think, I just think about, when you think about this hospital, particularly Mon Health Medical Center, you think about how the things have evolved in my career. You think about, it used to be aortic aneurysm repair was done through a 15-inch incision and was a 10-day stay in the hospital and a 6-week recovery time, and now We have surgeons in this hospital that do that through a tiny little skin nick in the groin, and the patients leave the hospital the next day. You know, we have cardiologists that are averting heart attacks, you know, in minutes. You show up at the hospital with a potentially deadly heart attack, and then you know, 24 hours later, you're going home on a prescription of medication and with some advice to take better care of yourself. I mean, it's just amazing, that kind of technology, and some of it, you know, has nothing to do with what we do, but certainly I think general surgery has really benefited from the evolution in technology, and that's what keeps us on our toes. I mean, there's always something new out there and available, whether it's a different kind of surgical procedure or a different kind of treatment. I think that's you know, really, really exciting, and at the same time demanding that you stay on top of that so that you can provide the best kind of care for your patients.
Great. Absolutely. Next question: what role does general surgery play in oncology?
So some of the teamwork in this hospital is between the medical oncologists who pioneer the chemotherapy, the radiation oncologists who take care of the radiation therapy, and the surgeons. Depending on the disease, sometimes it needs to be cut out up front. Sometimes it has to undergo chemotherapy and radiation prior to surgery. It's a very team-based approach. You know, one of the important things about how we manage cancer patients in this hospital is every other Wednesday, all of the surgeons, all of the medical oncologists and the radiation oncologists, the radiologist, the pathologist, we all sit down together in cases that are complex or not quite the standard way in the textbook. We present them, and then instead of just having me as your surgeon coming up with your treatment plan, there's actually 6 of us who are contributing opinions and experiences. The same with the chemotherapy regimen and radiation.
So my answer to that question is, you know, in a community like Morgantown, the great thing and the responsibility to the general surgeon is, as Dr. Dodson mentioned a few minutes ago, you really have to be able to take care of a wide variety of diseases, and so including cancer. And so, whereas in some places, you know, you may have a specialized surgeon who only deals with pancreatic cancer or whatever. Here in Morgantown, I mean, we take care of patients, and you know, that we routinely take care of patients with complex surgical problems, some of which are cancer, some of which are not, and therefore, you know, in terms of, as a general surgeon, this is routine for us to deal with patients who have cancer. So it's a routine part of our practice, and it's awe-inspiring that we get to do that and get to help those patients, and yet at the same time, it keeps you really on your toes. You really got to know what you're doing. You got to pay attention, and you got to keep track of the literature and make sure that your techniques are first rate.
You're doing a wonderful job because patients adore the both of you. So thank you. All right, those were some amazing questions. Thank you so much for being here, Dr. Johnson, Dr. Dodson. We really appreciate you. We are so happy you're with Mon Health. Thank you for everything. Thank you for tuning in tonight for General Surgery. We will see you next month. Have a good night.